Hi, this is Chapter 32, Caring for Clients with Disorders of the Lymphatic System. The lymphatic system, as it's shown here, it shows all the little lymph glands and lymph nodes. In the picture here, you see the lymphatic duct system and the two ducts that return the lymph fluid back to the venous circulation through one of two ducts. The thoracic duct, located in the posterior abdominal cavity, collects the fluid from all parts of the body except for the right thoracic duct that collects the fluid from the right side above the diaphragm. That includes the right side of the head, arms, neck, and chest. They both return the fluid back to their respective subclavian veins. Lymphedema. Lymphedema is a disease. It's actually a result of a disease. The pathophysiology and etiology, accumulation of the lymphatic fluid from impaired lymph circulation. A lot of women have this from having mastectomies. Not so much anymore. They don't do radical mastectomies as much as they used to. But now it's more of a focused laser type surgery that goes in. There's two types. There's primary and secondary lymphedema. They also get this from malaria infestation or infection, and that blocks the lymph glands. Assessment findings: you have a swelling of affected area. Skin is tight, firm, shiny, brawny, weeping or oozing. Elevation is the medical treatment. Compression sleeves or stockings, complex decongestive physiotherapy. Skin assessment, exercises, elevation, elastic garments, and they go over that quite well. Classifications: you have grade 1 is mild. This is where the circumference is 2 centimeters but not more than 4 on the affected limb over the unaffected limb. The grade 2 is moderate and goes from 4 centimeters to 8 centimeters on the affected limb, and grade 3 is 8 centimeters or greater. With grade 1, the client is asymptomatic. Grade 2 experiences symptoms such as heaviness in the limb, pain, and limited movement. Grade 3 involves the entire limb or is accompanied by infection or cellulitis. Question: a woman undergoing a modified radical mastectomy is at risk for ineffective tissue perfusion and lymphedema. A nursing intervention to prevent compromised flow of the lymphatic fluid to the upper extremity include, and you can have a look at those and see what they are. You ready? Go. Ready, set, go. Supporting and elevating the arm on the side of the mastectomy. Elevation promotes gravity drainage of fluid trapped in the soft tissue. So, lymphangitis and lymphadenitis. Etiology is a streptococcal microorganism infection. Assessment findings: red streaks, fever, tenderness, enlarged lymph nodes. Medical treatment: broad spectrum antibiotics. Assist with the ADL, elevate extremities, provide warmth, monitor temperature and swelling, elastic sleeves and stockings application. Infectious mononucleosis. Now, infectious mononucleosis is caused by the Epstein-Barr virus, direct contact with the oral secretions. That is why they call it the kissing disease, because it is spread by the droplet secretions, causes lifelong Epstein-Barr virus in the body that survives for the life of the host. and may be instrumental in the development of Hodgkin's lymphoma. So once you get Epstein-Barr virus in your body, it stays with you until you die. So you have it all the time, and it lasts for um, a while. Usually the age of infection is 15 to 25 years of age. The incubation period is 30 to 50 days, with fever that lasts for about 2 weeks, along with sore throat, marked whitish gray exudate, adenopathy, enlargement of the lymph nodes, most commonly the anterior posterior lymph nodes, and about 50% of the clients show a splenomegaly, enlargement of the spleen, and 10% of the clients have a hepatomegaly, enlargement of the liver. So this can go on for 2 weeks. Usually, I never had this as a child or a young person, 15 to 25, but that's where you're going to look at, okay? So, question. The characteristics of infectious mononucleosis include all of the following except. Okay, look at those there. Figure it out. Okay, ready, set, go. Answer. Incubation period is 10 to 14 days of exposure. The normal incubation period of infectious mononucleosis is 30 to 50 days after exposure to the virus, and the virus remains in the body with the person a lifetime. Okay, so now Hodgkin's disease. Pathophysiology is this Hodgkin's disease is a malignancy that produces enlargements of the lymphatic tissue. It can affect the spleen, liver, and with invasion into bone marrow and lungs and bone. With Hodgkin's, it creates cells called Reed-Steinberg cells that are a mutation of normal lymphocytes, that are immortal and keep producing the same cells. As mentioned in the previous slides, Epstein-Barr virus has been linked to the formation of Hodgkin's lymphoma. Assessment findings, you have painless lymph nodes. Usually it starts up in the cervical area, and they notice an enlargement of the lymph nodes, and it gets worse, progressively worse. You can have epigastric pain or fullness, weight loss, anorexia, low-grade fever, night sweats, pruritus, anemia, thrombocytopenia, poor resistance to infection. So you have to watch these people for infections at all time. Nursing process, the Hodgkin's disease, assessment, history, symptoms, mononucleosis, physical assessment, lymph nodes. You want to take the history and find out if they have had mono. Risks include ineffective airway clearance, impaired gas exchange, infection, impaired skin integrity, and so forth. The disease is more common in men than in women. Some people survive for 10 years or longer, and then some die within 4 to 5 years. Part of this is in relations to the stage of discovery. What stage were they in when they discovered that they had Hodgkin's lymphoma? Paul Allen died from Hodgkin's lymphoma. Hodgkin's disease, diagnostic findings, CBC, blood chemistry test, CT, MRI, lymphatogram, a graph, chest radiology, staging 1 through 4. Stage 1 is a single lymph node region is involved. Stage 2, 2 or more lymph node regions are involved in on one side of the diaphragm. Stage 3 is lymph node region on both sides of the diaphragm, but extension is limited to the spleen. Stage 4, bilateral lymph nodes affected, and extension includes the spleen plus one of or more of the following: bone, marrow, lungs, liver, skin, gastrointestinal structures, or other sites. And then on top of that, it is further divided into A and B. A is without general symptoms, and B of the B category, and they are follows: unexplained weight loss by more than 10% of the body weight in 6 months before diagnosis, unexplained fever, temperature above 100.4, drenching night sweats, with the first two being the most important for staging. Okay. Question: a client diagnosed with Hodgkin's disease is at risk for infection related to the immune suppression and drug or radiation therapy. To assist the client to remain free of infection, the nurse should implement which of the following? Okay, look at it, see what you're thinking there. What are you looking at? Okay, and the answer is restrict visitors with infections from contact with the client, reducing the number of organisms in the environment, and restricts visitors and personnel with an infection reduces the transmission of the pathogens to the client. Okay, now we go to non-Hodgkin's lymphoma. Etiology: this is a malignant disease that originates in the lymph glands, causes genetic link, environmental triggers. There are 30 subclassifications of malignant disease that originates in the lymph system. The number of cases are 6 to 7 times the number of Hodgkin's disease. There are 2 classifications. One is indolent, meaning the client is relatively asymptomatic, and 2, aggressive, because the condition has a shorter onset and acute symptoms. Nevertheless, 30 to 60% of the aggressive forms are curable with intensive therapy. Medical management: you're looking at radiation, chemotherapy, immunotherapy, monoclonal antibody therapy. Now, this is an interesting thing, because what they do is they take the Hodgkin's and they inject it into mice. Mice are immune to lymphomas, and they will develop these monoclonal antibodies, and then they grow these in petri dishes and then give them to people, and then that helps them get over this non-Hodgkin's lymphoma. So it's quite interesting. Bone marrow transplant, stem cell transplant, autologous, allogenic, chemotherapy and radiation therapy encourage extra fluid intake, especially when they have that type of thing. Monoclonal antibiotic therapy: the human cancer cells are injected into mice, like I said, and other animals that then produce antibodies against the cancer cells. Then these cells are injected into the humans that continue to produce cancer-fighting cells that attack the cancer. Sometimes these cells are given with chemotherapy and radiation to attack and destroy the cancer. Okay. Question: a client with non-Hodgkin's disease is admitted to the hospital. In discussing the client's care with the nursing assistant, which nursing explanation is most correct in relation to the medical management of this disease? Okay, think about it. Which one did I say multiple times during this presentation? It's A, radiation and chemotherapy. Non-Hodgkin's lymphoma is treated with radiation and chemotherapy or both. Immunotherapy with monoclonal antibodies and bone marrow transplants, are used to cure lymphomas or extend the life of the client. Okay, so that's it for today's lecture. I will catch you on the flip side, so keep watching.